Welcome back to another episode of Sports Medicine on Tap. My name is Brandon Align. I'm sitting here at Neck of the Woods Brewing Company enjoying a nice cold sour crafted by our good friend Frank with my good friend Dr. Frey and our welcome back guest, if you will, Dr. Matthew Poots. Gentlemen, welcome back.
Well,
Dr. Poots, thanks for coming back on with us.
Yeah.
The first time we had you on was episode 85 when we talked about C.J. McCollum and a collapsed lung, so kind of the out of the ordinary kind of stuff. So you're a little bit of a outside of the orthopedic wheelhouse, if you will. We call the specialist in.
Yeah, outside of our outside the box.
Outside of where we're most comfortable talking about. So guys, how you doing? What's going on? And then we'll dive into this a little bit.
Yeah, so thanks for having me back, guys. I appreciate it. I enjoyed my last stint here, so always a pleasure to be your guest and offer my services wherever I can.
I love it. I appreciate it.
Yeah, we do appreciate it because some of the stuff that we were going to talk about tonight, Dr. Frey and I, before you got here, we were pre-show talking. We were like, thank God he's coming on.
Right.
We don't know what we're talking about for this stuff.
Every now and again, we'll get a topic, and I'm like, a little bit outside my wheelhouse. I know enough about it. I'll do a little research. We can get by and do a decent show. I have no shot. I have no shot on this particular topic, and we got a couple. It'll be fun.
Good. So that's why we, luckily we have our good friends at Virtua giving us all the specialists. And just to give a quick shout out to our sponsors at Virtua Orthopedics and Spine. They have you covered from runner's knee and dog walker's hip to yard work back and laptop wrist. They got a doc for that. Find the right specialist for you at virtua.org/ortho. So before we go ahead and just dive in, we'll just give a little backstory. The first story we're going to talk about a little bit here, a little older, almost a couple weeks old, and I think a few weeks old. And with this was like when Dr. Frey and I brought it up, we were like, oh, we got to find someone good to talk about it.
Yeah. And
just the timing of everything, and it was like one of those things where like it's not urgent, it's not going to be like life changing if we don't, or earth shattering if we don't cover it right away. So we're going to dive into Dustin May, the LA Dodgers pitcher, who was reported for out for the season because he had an esophagus tear and required surgery.
Yeah.
And so that is completely outside.
Not something commonly seen on the field or the pitch or the ice or the whatever it is.
Yeah. not something you normally see on an athletic field.
Yeah.
So a little backstory. It kind of came back from July 13th is when the report came out. And again, not something that happened on a field, on the baseball field or anything like that, but he started to feel ill at dinner. Yeah. And then the next day he went to see a doctor because he was having some throat and stomach pain. And then he was also coming back from Tommy John surgery, and he was in the process of starting to make his rehab assignments in the next coming weeks. And kind of like right around now is when he probably was pretty close to coming back and getting on the field for the Dodgers, who kind of need some help in their pitching rotation because they're all kind of banged up.
Snake bitten.
Yeah. So let's go into it. What do we think about
First, what is it? What is an esophageal tear?
Yeah, so esophageal tears are bad things. We'll just start with that.
Well said.
And if you read any literature on it, any textbooks, it carries 100% mortality if it's not fixed, identified and fixed. So it's a real urgent problem when you have this. So just to back up, give a little anatomy lesson. So the esophagus, it travels, it's part of the GI tract, but it connects the mouth with the stomach.
Right.
So it travels down through the chest, by the lungs and all those other organs like the heart. Yeah. And then ends up going through the diaphragm and connects with the stomach.
The heart is that thing that pumps the ants after the rest of the...
Yes, that's right. Very critical.
To heal. Important there, right?
Yeah, exactly. So he had a tear somewhere in that organ, and again, these are things I fix on a regular basis as needed. They're not very common, but when they do happen, it's an emergency.
Right.
So I want to know all the nuts and bolts here, and I'm getting nothing, right?
It's hard to find.
Very hard.
Yeah, so I don't know what really happened to him. Right. So the story is very vague, but basically he had a really bad problem.
Yeah.
And they do say that he had surgery. So I'm assuming, most of the ways we fix this is with an incision on the chest wall, what we call a thoracotomy.
Right.
Go between the ribs, spread the ribs, and you physically have to repair the injury.
Right.
So at close, bring, muscle flaps and things like that for coverage and healing. And then all that has to heal.
So and these are big incisions. And,
These are big incisions, which take a while to heal.
Sure.
And he'll be quite, run down from the stress of surgery and infection. And the question is, how sick did he get before they fixed it? We know nothing. How long was he in the hospital?
Yeah.
Et cetera, et cetera. So, yeah, it's kind of interesting. He's a young guy.
Yeah.
He's about 26, 27 years old.
Yeah, and this doesn't happen that frequently in that age group. Like there's a lot of unanswered questions.
What would you say would be more of a typical age group that this would wind up happening?
Yeah, so the more common things that you'll hear about tears is happening in the older population, and commonly it's been called Boerhaave. Like that's a word you might hear.
Right.
Boerhaave was actually the original. He was a physician in Holland back in 1724.
All right.
When he first recognized this entity, so he got the name. So
there you go.
It's attached to him.
You got it.
He got it. But usually it happens after like binge drinking or eating. You vomit against a closed kind of glottis, and the bottom half of your esophagus tears, and usually tears like into the lung space.
Oh God.
And usually something bad has happened.
Right. I imagine it's painful.
It's not
process.
subtle. It's painful, and they said he was having a lot of pain.
Yeah.
So maybe that he had some event similar to that. I don't know. But
is this a scenario like at that point he's like vomiting blood or like?
Yeah, so you can vomit blood because when you tear your esophagus, it can bleed. You'll probably vomit whatever you ate, things like that.
Right.
So it's pretty dramatic. So that's kind of the typical thing. And then outside of that, I've seen all sorts of things. I mean, I've seen people swallow things like dentures, and they can make tears, and or you can have an endoscopy, or when they go down with the scope and you have a stricture, they can tear. So there's all sorts of other ways to get there. Right. But this kid was healthy. Went to dinner or just doing his thing, and he gets a tear.
Right.
Boy, that's dramatic.
And so with that said, right, like this is not something that's like could be a chronic issue. It's not like a thinning and then all of a sudden it gives out, or is it usually like an acute some sort of something?
Yeah, it's an acute thing. The esophagus doesn't necessarily spontaneously rupture.
Right.
It's just that doesn't happen. Now I've seen tears from traumatic events, people in motor vehicle accidents with, believe it or not, from blunt trauma. If you hit it hard enough in the right way. Yeah. But again, very, very rare. It's not a typical thing.
What if he was, and this is sort of getting outside the box, and again, so this is pretty foreign, right? Like you have to, treat us like, you're kindergartners and you're walking us through it. But so let's say, he was coming back off of collateral ligament reconstruction, and let's say he's got some soreness in the elbow and he's taking a lot of NSAIDs, anti-inflammatory medications, Advil, Aleve, and he's going crazy, and the gastric issues associated with that, does that in any way predispose him to having this particular type of an injury?
Yeah, generally not.
Okay.
Generally, when we talk about NSAIDs and all those things, it's more the stomach lining and gastritis, gastric ulcers, things like that. People can get ulcers of the esophagus,
right?
But in a very different setting. That's also very uncommon.
Okay.
And in theory, they could spontaneously rupture.
Right.
I've never seen it.
Yeah.
So it is very, very uncommon. And and again, with the scenario you kind of painted, no, not typical to have the esophagus be injured from all that.
Impacted,
it's more like downstream. So again, odd.
So I guess speculation here, right? Because we don't really know. Like we always say, we don't have access to the medical records, and this is definitely way out there. This is not thoroughly reported. It's not like there's a video of him having something happen in a game or whatever.
Right.
But it could be, like we said, I don't know, speculate. Maybe it said he started to feel ill at dinner. Who knows what he was eating? It could have been like a food poisoning thing, and then he was throwing up all night, and that caused the issue, and then next thing you know, just that weird, uncomfortable pain probably just doesn't go away, and then you got to get that checked out.
And could like you said, people have swallowed their dentures and one. Could it like the nacho went down the wrong way, or the chicken bone wing after his hot wings went down the wrong. Like is it possible something like that just punctured or?
It can be, but again, not common. Now, humans have been around for a while. We've
Right.
eaten all sorts of things and done okay.
right.
Nachos, not so much. But what we see is if you do get a chicken bone stuck, let's
Yeah.
just say, and it sits there for hours and days,
Yeah.
that can cause necrosis, and that can eventually
Make its way through.
make its way through. But usually that's going to be somewhat of a prolonged occurrence. It's not going to be like
Hours or days, kind of a thing.
hours to days.
Hours to days.
Yeah,
Yeah.
You know, so
Don't eat chicken bones.
No, not
Noted.
don't eat the chicken bone. Yeah.
just eat the meat.
Yeah,
Okay?
just eat the
and
meat.
chew it.
Yeah, spit out
Not
the
the bone.
bone.
The bone,
Right.
you know, they can send to the orthopedist. And
Yeah. Then we'll take care of it.
they can take care of it.
Once this happens, I would imagine it's fairly urgent, probably emergent. What kind of a time frame does someone typically have before things really, really go south? Before it's a little bit too late to help them?
Yeah, I mean, it's this is something that as soon as the event occurs,
Yeah.
right, your body's under stress,
Yeah.
and it only gets worse and worse and worse at times.
Like
goes
dramatic,
on.
obvious
So
stress.
so it just depends on what, like to answer your questions directly, it depends on what the injury was, how bad it was, how extreme it was.
Yeah.
But the idea here is each hour that ticks by, your body's, getting sick, septic,
Right.
the infection's starting, it's going to spread throughout your body. So, within 24 hours, you're sick.
Right.
And even before that, you're going to feel like hell.
So is it more of a bleeding issue, or is it more of a sepsis issue?
It's more of a
Because right now, all of a
sepsis.
sudden, you have continuity into areas that
Yeah.
are that are supposed to be sterile that are no longer sterile.
Correct. Yeah. So it's usually sepsis, infection, not
Okay.
necessarily the bleeding. It really is the sepsis and infection that sets in pretty quickly because, like you said, it's a contained space where things like that shouldn't be happening.
Right. Right.
Yeah.
So what does that look like from a recovery standpoint now, like for
Yeah.
food, eating, and drinking after surgery? Like how are patients limited in what they can and can't do, I assume?
So early on, we'll start them, like once we repair, immediately after repair, we may not feed them for a week,
Right.
5 days, 7 days, something like that to let that injury
Rest.
heal.
Right.
And then you kind of test them with these water soluble contrast studies where they drink some contrast and make sure it's not leaking still.
Okay.
That's number one, to make sure it's sealed and healed.
Right.
And then you can gradually start reintroducing diet to them and,
Right.
and going from there. But that's the critical thing, is making sure it is, once it's been, operated on, that it stays that way and sealed. Because sometimes if it may not, if you have a really, really bad tear and you try to fix it,
Right.
it may still need time to fully heal itself.
It's not quite there yet.
So they may not be on a diet for weeks.
Right.
So
that's possible.
in that scenario, and we're probably getting a little in the weeds here, but I'm just
Yeah.
kind of curious. Are you putting in something like an NG tube that passes it? Or you're doing or
Yes.
like TPN? So nutrition that goes through your veins, basically IV nutrition, or like a peg tube into the stomach itself?
Correct. So if you can't get these folks eating and get nutrition in a
Right.
week, you got to put in some other additional source.
Right.
And if they're not going to be able to eat, for weeks, then we'll put in surgical feeding tubes
Yeah.
potentially to feed them through that. So, again, it doesn't mention what happened to him, but it sounds like he had a good recovery.
Right.
There really wasn't much lingering, unless they would have
Yeah.
reported it, I suspect. So
Right.
it sounds like they found it, fixed it, and now he's on his way to recovery, so to speak. But
And I think that makes a little bit of sense just in the grand scheme of things. Why, like, I don't know, when I first saw it, I was like, oh, that's pretty wild that it's automatically season ending. But, like, that makes a lot of sense. I mean,
This is a
for
recovery,
an
a long
athlete,
one.
not eating for a week or not
Right.
having proper nutrition, that, sure, all kinds of atrophy and, like, muscle deterioration and endurance, all that stuff obviously goes that way out the window.
Yeah.
And let alone building that back up over time and having to deal with all that is probably much longer than
Yeah.
And
at
he's a-
least I initially thought about.
And when people get septic, like it's devastating to the
Right.
system, right?
Right.
Like I'm sure, in addition to not eating, there's all this weight loss, there's all this muscle loss. He's in the hospital, like that's
Yeah.
sick, really sick people.
Right.
Man.
And he's a pitcher, right?
Yeah.
So
Pitcher, yeah.
he's like, his chest wall, I'm assuming he's had, that's all got to heal. That's
Right.
going to hurt for
That's
a
another
while.
really good point.
I mean,
Yeah.
he's, and again, it's not like the average person I see is not pitching.
Right.
They don't need to go, they just need to get up and go to work.
That's right.
Right, at a
right.
desk or something.
Yeah.
This guy's got to pitch. He's
Yeah,
got
you
to
know,
fully
I mean,
extend
yeah.
himself every day.
And
So
big incision. Is there any way to do it if, let's say, in the scenario where it was a smaller puncture or a smaller hole, to do it endoscopically, to put a tube down his throat and look and try to get it to seal up that way.
That's
Flex seal or something.
Yeah, now, Flex Seal, exactly.
Right.
Fix the flat.
Fix the flat it.
Some of those are options.
All right.
Those are more kind of.
Fix the flat. That was good.
Yeah, just spray the inside,
right.
just seal it.
It's all
Right?
good.
Makes sense.
Right.
Yeah, I don't see what the big deal is.
Right.
People, sometimes we use stents in the esophagus to seal leaks. That's a possibility.
Yeah.
That's very kind of operator dependent, situation dependent. I've done that in older folks who wouldn't maybe tolerate an operation.
Yeah.
They're just, they wouldn't make it.
Yeah.
And sometimes you do it, and it's not ideal.
Yeah.
And you try to get them through it, but
Just doing the best you can.
the best you can. They have undrained infection potentially. So there's all sorts of other ways. Surgical intervention is tried and true. You know
Sure.
what you're going to get.
Yeah.
And that is probably the quickest way to get someone through this,
Yeah.
besides other endoscopic approaches which are available potentially.
Yeah.
But again, this guy, he had surgery, they said. So that's
Yeah.
that's all we know.
Yeah.
So we're assuming. It's interesting, the esophagus, even if you have like a tear up in the neck, let's say, high up near the pharynx, sometimes those are treated non-operatively.
Oh, really?
Just with like antibiotics, maybe drainage and things like
How,
that.
how does someone get that?
Well, same way. Same way. If you have, again, something,
Darn chicken bone.
darn chicken bone, that's, gets stuck high up and you don't know about it and causes a perforation and things like that. So that's more, and that's kind of like, ENT specialists
Sure,
get
yeah.
involved. I don't get involved so much because it's non-operative and there's not much to do. But
Right.
but this guy had surgery. It sounds bad.
Right.
So when I heard that story, I was shocked. It sounds like he did well.
Yeah. Fortunately, right? Like,
Right.
and maybe it's unusual in a young guy, but maybe youth is on his side, kind of a thing, where
Right.
the system can handle
Bounce
it
back.
slightly better than someone who's in their 60s or 70s.
Mm-hmm.
I get that this is not typical, and thus it makes it very challenging to kind of predict the way things may shake out. But the MO of the show has been take an injury, use that injury as a springboard, teach other people out there, other sports med docs, athletic trainers, people that are involved about this sports med. And this is very sort of outside the sports medicine realm, but just happens to be in a professional athlete. Hence, we dragged it in to talk about it a little bit. Maybe someone's at a team dinner and something goes awry. All right, then it plays in. But for him in particular, do you think there's a pretty good chance or a reasonable chance that once he recovers from this, once he heals, the season's out, right? It's done. Next season, assuming that if the ulnar collateral ligament, the Tommy John surgery goes well, would this hold him back from getting back or being the same player that he once was?
It shouldn't. At the end of the day, it shouldn't. I think he'll get back to where he was.
Right.
He'll have to work at it, rehab. And it depends on what's affecting him or what he actually had done. But no, I think ultimately he'll get back to where he was.
Yeah.
It's not going to be this season.
Will strictures or anything like that be an issue going forward for him in his esophagus?
So good question.
So like a tightening.
Yeah, tightening. Generally not. Most folks, at least in my experience, have done pretty well. But it goes back to like why it happened in him. Maybe he had a stricture already. Maybe he had some underlying condition that predisposed him to strictures. Sure. And we were talking about earlier eosinophilic esophagitis, which is this kind of inflammatory process in the esophagus. Maybe he's dealing with something like that, and those folks can be prone to strictures. So. Like with that being said, I don't know, but that can be treated with medications, that condition, and folks do very well. And maybe he just had a bad day, a real bad day.
And I mean, at least for him, coming back from Tommy John, and obviously getting this is not a good thing at all, but at least it gives him some more time to heal up for that.
Not the way you want it.
Not the way you want it. So, but with that, another question for you would be, being that he's a baseball player, right? Does anything in the world of baseball, if you will, would predispose you to have issues with this? Like, I know baseball is big on chewing tobacco and other things like that. And he's young, and the young thing to do is now vaping and all this other stuff. Does any of that stuff get incorporated with this, and it could predispose them to having these issues or could cause issues down the road?
Yeah, not necessarily. All the tobacco products, chewing tobacco in particular, that's more upper airway, oral.
Right.
It shouldn't really affect the esophagus. Vaping's just bad for your lungs.
Yeah. right. So neither of those.
So nothing
Right.
of those specifically to that point. Yeah, I mean, this is really an oddity. When I heard that, I was when I heard the text, I'm like, we're talking about what?
Right. Exactly.
Like that's the last thing I would have thought about.
And that's pretty much exactly my
Yeah.
Yeah.
my reaction
Yeah.
when I saw the article from either I sent it to you or you sent it to me, and I was
Yeah.
just like, what? How'd that happen? And I'm like, that's way outside of
Yeah.
my differential diagnosis when I think about anything regarding to that.
Yeah.
Like you had said previously, we're 100+ shows in, right?
Yeah.
We've covered a lot of the main topics, and frequently more than once. Every now and again, you get like a weird one like this. And granted, it's not mainstream sports medicine, but
Right.
it's just different and
happens.
something different to
Yeah,
talk
it
about,
happens.
and it's relevant in the sense that it's in a professional athlete, and hey, let's see how this is going to impact them.
So I guess we kind of talked about it before, but like roughly timeline. You said that you usually see people how does the average person take from this surgery to get to say back to work?
Yeah.
Even if work is
Just-
sitting at a
Yeah,
desk.
Yeah, just general
So,
work.
so
without-
yeah, if they recover uneventfully, we do the repair, they're in the hospital a week, 10 days, they go home, then usually about 6 weeks,
Okay.
of
not
kind
terrible.
of
No.
downtime, because a lot of it's just the fatigue of surgery.
Sure.
The fatigue of the infection,
Right.
Right.
and that can vary greatly from person to person.
Right.
Because they'll be on antibiotics for, a month or so anyway, to cover anything potentially. So, usually by 6 weeks, they should be kind of like feeling okay.
I think I'm biased or tainted by orthopedic surgeries, which tend to have longer recoveries, especially
Yeah.
in the world of sports medicine, right? A lot of
Yeah.
tendon and soft tissue injuries and whatnot. So I hear 6 weeks, I'm like, walk in the park.
Yeah,
Yeah.
that takes
Nothing.
Yeah. Your stuff takes a while to heal.
Yeah.
Right.
And
That's
you can't
exactly
use
right.
it. So, but again, to get back to pitching,
Yeah.
it's probably going to be a lot longer.
A lot longer than that. Yeah.
A lot longer.
6 weeks just to kind of get comfortable.
Yeah,
and
just
move
to
around a
get
little
comfortable,
bit.
move around, like you're feeling like, okay, I can
Yeah.
do this now. So
And
for
then I'm
someone
sure-
like him,
Yeah.
you're talking months and months.
For
Right.
sure.
Yeah.
Yeah.
just to build up everything he lost.
Well,
Yeah.
because now he can't do anything for months, right?
Yeah, right.
Because he got everything healed.
Yeah.
Now he's already rehabbing from months of surgery. So could you imagine how, like, he's just, relative terms, he's debilitated, right? For
Absolutely.
a sports
Yeah.
athlete.
And the Dodgers are snake bitten. They've had a lot of injuries, but they're still the Dodgers, and it's still a good team. And they may be looking at baseball in October, but even that, I got to imagine, really no shot.
Yeah.
And then you got a few months.
Trade deadline today, right?
Or was
Yeah,
it today?
it is
Yeah,
today,
yeah.
yeah.
A lot of action.
Hopefully they,
Yeah.
Make some moves
Make,
eventually.
some
Fill in the
moves.
void.
Yeah, a little
Yeah.
bit there.
Yeah.
Probably
yeah,
a void they weren't expecting to have.
Of course.
Yeah,
Yeah.
I mean, they were expecting the kid to come back. And
Yeah.
now-
start plugging some
Yeah.
holes, not creating one.
Yeah, for real. Yeah, just an interesting story.
Yeah.
Overall.
Now, what about the other one that we just saw last night
The
or a couple days ago?
the couple days of the football one, right?
Yeah.
So the next story we're going to dive into here is we're going to take a little step into the NFL. The New England Patriots, their third-year defensive lineman Christian Barmore,
Yeah.
was diagnosed with blood clots.
Yeah. Second round pick out of
So-
Alabama.
Yeah, out of Alabama, and I found out he's 25 years old. He's from Philadelphia too, so he's a Philly guy, local. So ironically, we're covering
All
a little
right.
bit about him.
Yeah. Didn't
but-
know that. All right.
Yeah. So I guess he was sent to the hospital. They discovered some blood clots, and they said he's out indefinitely. And they're obviously just more or less concerned about his general health right now, and just
Yeah.
trying to figure everything out. But this is a big individual. He's 6'5", 315 pounds.
Right.
Big boy.
Right. I
Big-
guess that could be a risk factor. Yeah.
Right, like I thought when I was looking up his stuff, I just was curious his size and position. I was like, at the defensive line, he's got to be pretty big. And I was
Yeah.
like, 315 pounds.
That's big.
That's a big boy.
Yeah. But another weird one, right?
Another weird one. And
Right.
again, we're not sure where the clots are.
Right.
Right.
This
We
is-
don't know. When we talk about deep vein thrombosis, just
Yeah.
to get technical for a second, DVT,
Yeah.
they can happen in the legs, or they can then travel to the lungs.
Right. Right.
Did he have a
What's the difference there? And what is it called when it's in the lung?
pulmonary embolism?
Right.
PE.
Yeah.
But clot in the lungs is bad.
Right.
Because that can obstruct blood flow and oxygenation and all those important things.
Right. Right.
Especially for athletes.
Yeah.
So again, we're kind of at a loss, and we need to know in these situations. Yes, his size is important.
Sure.
People who are bigger, overweight are at slightly higher risk.
Yeah.
But he's a young guy, you
Right.
know. So the
And an
question
athlete.
is,
And
an
active,
athlete.
right.
So an active, right?
Right.
Yeah. So, you know, what we always talk about, was this a provoked DVT or a non-provoked DVT?
Right.
You know,
Right.
meaning
What does that mean?
Yeah, so that basically is there inciting event, such as having surgery.
Right.
Right.
You know, sitting on a plane for 10 hours,
Right.
you know. Did something happen to cause that clot and then the clot to travel, let's say, to the lungs? Or was he just like walking around doing his normal thing and all of a sudden, hey, I got a blood clot?
Out of nowhere.
Out of nowhere.
Right.
Yeah,
So
I thought it was interesting too. With like, I read, I don't know, 3-4 articles about him, and then I saw one like little snippet video of Ian Rappaport on Twitter talking about that. He started off as like a bruise on his calf of some sort, and then like the athletic trainers were just like, no, we got to get this checked out, and they kind of like forced the issue and sent him to the hospital, and then he was diagnosed with a blood clot. So, again, not bruises on the leg happen all the time in football.
What a strange sequence of events
Right.
that turned out to be a blood clot.
Right.
Well, because to your point is, I'm sure every, you know, NFL player gets bruises on his
Right,
calves,
easily.
Right.
and then now you're going to be like screening for blood clots and
Right.
everyone.
Right.
And a bruise on your calf is a hematoma or blood sort of under the skin that you're
Correct.
looking
Exactly.
at, not in the vein, which is what a DVT
Right.
is. And then it's also in the calf, where typically it's not as big of an issue
Correct.
as opposed to up into the legs. Like it's such a strange sequence of events for
Yeah.
for that to be the initiating. Where
Yeah.
you know, we're typically taught like calf pain, swelling of the leg, swelling of the calf, cords. Like if a really thick one, you can actually feel kind of like a cord in the in the back there. Like as a sort of your warning signs here for a DVT. Typically, bruising's not up there. Like people make that jump, but like that's not one of like the standard worries, because again,
Right.
that's hematoma. That's, you know, some clotted blood below the skin where you can see it,
Right.
not necessarily in the vein or the deep vein, which is what you begin to worry about.
And this was not. This is his first event, right? They didn't say this was a
Yeah,
recurrent.
I
This
As
was
far
believe
as-
so.
I don't
Right.
know. My guess would be yes.
Yeah.
I would guess so that it's his first event, because he just signed a pretty lucrative 4-year, $84 million deal this offseason. So I don't think they
I'm
were
glad he got
concerned.
that done.
Yeah, he got that done in a good period of
timing.
time there as well. I just think it's interesting, and it's
Yeah.
oddly enough, was when I was looking this up, is that the New England Patriots isn't their first time dealing with blood clots in their athletes.
I remember.
Back in 2019, their center David Andrews was diagnosed with blood clots in his lungs,
hell?
out for the season. Then he did return in 2020.
Right.
So now, is that reason why they pushed the envelope and said, no, maybe let's be a little conservative and let's just send you to the hospital just in case? Because I would assume
You've
that
seen it before.
You've seen it
It's the
before.
same
you
staff.
know, like you kind of a little more
Hypersensitive.
to the situation. Like, I don't know, that makes me a little uncomfortable, and let's just send it just in case.
Honestly, that's part of what this show is all about, right?
Right.
Like to put it out there so that people are, the antenna is up, the red flag is up, so you're looking for it.
Right.
Whereas you're not, and then you miss something, and maybe then it turns out badly.
Right.
But yeah, you're 100% right. If they just saw this a few years ago in another athlete, you know, even if it wasn't the classic presentation, and we don't know that it was or it wasn't, but even if it wasn't the classic presentation, they're hypersensitive to it, and they're like, go get this checked.
Yeah, just in case. I mean, they're sponsored by the UMass General Brigham as a team, so I mean, they must have good connections. Obviously, they're professional athletes too, so just send them just to get checked, just in case.
Sure.
There's nothing wrong with being a little conservative. It's always
Right.
good to send them. It's like, oh, nothing's wrong, versus not sending when something's really wrong and you missed it.
Yeah.
Did they give us any updates how long he's going to be out? We don't have any
Just
like
out
follow up,
indefinitely,
right?
Yeah, just said indefinitely. I
Yeah.
think the coach was on a quick press conference after like their practice not too long ago, and they just said, "Yeah, we don't have a timetable right now. We want him back, obviously, because he's one of their better defensive players, obviously. You know,
Sure.
So that's a little bit of a curveball for their their whole strategy going into the season.
Yeah. I have to
Yeah, so-
imagine whatever the root cause was, and sometimes there's none, but whatever the root cause was is going to impact how long he has to be out. And like
Correct.
we were talking about a little bit before the show,
Right.
because whatever the root cause was will determine or factor in at least how long he winds up being on blood thinners, anticoagulation.
Right.
And I don't think you can play football if you're on a blood thinner.
Yeah.
I just don't think that's a good
Correct.
recipe.
No.
Yeah, and I guess we should specify treatment for blood clots is
Right.
blood thinners.
Right.
Right.
And if it's provoked, then maybe 3 months
Right.
would be the best case scenario because you have an
If it's
event.
provoked, it's shorter.
Yeah, much
Right.
shorter.
Because you eliminate the factor that
Right.
induced it.
And those 3 months is when you're at the higher risk of having more or having blood clots go to the lungs. So that's kind of that time frame. But to your point, yeah, we don't know.
We don't
And
know.
and probably a bad idea to play contact sports,
Probably.
Yeah.
especially football,
Especially
at an
football.
elite level.
Yeah.
And
is
then
fr-
as a
is frowned
defensive lineman
upon.
where you're hitting your
Knocking
head
heads.
almost
Yeah.
regularly.
Yeah.
You know, like almost every play, the people in the trenches, if you will, they're the ones who have the most subconcussive blows to their head on higher risk than everybody else. So
You know, you just mentioned, blood thinner. Typically, that's your standard, right? Someone has a DVT if you catch it, and like you were saying, actually, to digress for a second, they have this access to the docs, easy access. We're kind of taught as soon as that thought enters your mind, as a doc, as a surgeon, as soon as the thought enters your mind as a possibility, just check, right? Like it's far better to swing and miss because you've checked, 10 times and they were all negative than to miss the one, right? And then it turns out pretty badly. So typically we have a real low threshold for checking. I'm sure that factored in. So let's say, you just said the treatment is typically blood thinners, right? If someone has a DVT, it's in their vein, it didn't break off and go to their lungs yet. What if it does break off and go to their lungs? How does that algorithm or some of the treatment options change?
Well, it's still blood thinners,
Right.
Then you get into this whole realm of how bad the PE was.
Right.
Whenever a blood clot goes to the lungs, then you worry about heart function potentially or strain on the heart.
Right.
So when everyone presents, we're always getting echoes, ultrasounds of the heart, make sure it's not.
Is it because the blood kind of backs up into the heart?
Correct, especially the right side of the heart. So, this is all, not to get too technical,
Yeah.
on the right side of the system.
Yeah.
And so, the blood drains from right to left. So if it can't get from the right side of the heart to the left side because the lungs are filled with clot because it has to go through the lungs, then the right ventricle or the right, pumping chamber is going to dilate and not work well, not be happy.
Right.
That's what you don't want to happen. And so you can have these massive clots, what we call saddle embolus, which kind of lodge right in the kind of the branch points of the main pulmonary artery.
It's kind of the entry to the lungs?
Yeah, correct. And that can be catastrophic, life-threatening. And so those situations, if people are that sick, they'll be on a ventilator. They may need like temporary bypass support. And clot busting drugs, or they can go up and kind of suck out the clots with these kind of thrombectomy catheters.
That part blows my mind.
So
interventional radiology, they're the guys that do that.
I mean, so much has evolved since I was in training.
Sure.
Back in the day, there wasn't much.
Right.
You just hope that the clot wasn't too big and you can support folks through it.
Yeah.
So nowadays we have a lot more. So that's the really kind of end game, so to speak.
Yeah.
It doesn't look like that's what happens here. I'm hoping this was just like a leg vein clot. Something. Maybe he was on a trip or something, and they get him treated, and the clot goes away, and he's back to work. But the other issue is that all these folks get worked up for genetic. Some people are predisposed because of genetics.
Yeah.
right.
Like factor V Leiden is a common one, or one of the more common, genetic predispositions that make you at risk or higher risk of clots. When you have things like that, then lifelong anticoagulation becomes a problem.
Right.
Or an issue or potential, and then
Possibility,
in an
right,
elite
yeah.
athlete, how do you deal with that? Do you take them off it, play a game, and then put them back on it, and you just kind of back and forth? It's a lot of things come to mind.
The management of that gets a little.
They're filters, right? So then you can put in a filter and potentially catch clots that are in the legs.
So yes, IBC filters, right? So if you imagine this is all plumbing.
So this
right?
is
This
it's
is all plumbing.
It's all plumbing. It
The
really
veins drain blood back to the heart, so
Right.
it goes from the lane bags up to the pelvic veins, up through the abdominal veins, and back to the lungs.
Right.
It's all plumbing. So if you put a filter somewhere in between there,
Yeah.
what we call the IVC filter, inferior vena cava, it can catch a lot of the major clots. Now you can still have
Little net.
small clots
Yeah.
go through, but it's the big clots that are going to kill you,
Yeah.
Right.
and that's what they catch.
Right.
So that's kind of a temporary thing we sometimes do use.
Yeah.
In the whole algorithm here.
Wow.
And I wonder if that factors in. So let's say he does have, factor V Leiden or another sort of predisposition to blood clotting. Can you take him off of his anticoagulants temporarily, put in a filter, which doesn't protect you if you develop a clot in your arm, but those clots tend to be smaller and less likely
Yep.
Right.
to be a problem.
Correct.
And then you try to catch everything. And
Correct.
it's like magic, the idea. They can go and they can put them in, and then they can go and they can take them out. Like
Yeah.
they expand and
Yeah, you can retrieve some
Magic.
of these.
It's crazy.
Sometimes if they're in too long, they don't anymore.
Oh,
They
is that
kinda-
right?
Yeah, so you have to be careful of timing.
yeah.
But
Kind of gets
yeah,
rusty.
It kind of gets rusty. Yeah.
Rusty
you
tubing
don't,
in there.
You don't
Right.
want that. Yeah.
Right.
So it's an issue. You have to be careful. So be curious to see what they ultimately find or what the updates are about.
So,
because-
and this is me just being paranoid, which is sort of my baseline, right? And reading into the article a little bit too much that I had read, but it seemed that the Patriots came out and made their statement, which I admire. Like, really, his health is really what matters the most here.
Right.
We have no timeline. We're just here to support him, right? Which is like the right attitude and the right statement to come out and make. But I read that, and the first thing I think, because one of the other predisposing factors would be if he has cancer, and then all of a sudden, is that where this is going? That there's something, and we're going to hear more about this later. And it was that the predisposing factor that potentially caused the blood clot.
Correct.
Yeah.
Correct.
So I don't know. I guess,
So that's a good point. Cancer makes you more thrombogenic, so
Right.
higher risk of clots. So,
Right.
so yeah, we'll
one
see.
of the things that I'm sure they're going to check.
We'll see what this,
Right, and it's like, I don't know. You hope it doesn't happen, but I mean, it's
Sure.
like one of those stories where you hear all the time where he's 25 years old, something weird happens,
Yeah.
and then they find a bunch of other
Find
stuff.
something
and
else.
just,
Yeah,
like-
yeah.
And then it's like way more than just football. It's just like this bigger picture of you got to take care of whatever's going
The
on.
long snapper, right, for the Eagles. What's
Yeah, Darren Boss, right? John Darren Boss.
Yeah.
Yeah, he was because he got traded to the Saints.
Saints,
and
right,
then
right.
they did a physical there, and they
Yeah.
found I forget what it was.
I think it was dilated. I think it was a aortic aneurysm or
Yes.
something, or maybe it was either aortic or was a little higher up. I forget where the aneurysm was.
Oh, really?
Yeah,
Yeah.
and then retired from football and saved his life.
and then became a
shit.
magician.
Became a magician. Very good one, actually.
Yeah, he
Very
really
funny
good.
guy. Yeah, one of those random things where it's just like dumb luck.
Right, and you never want to see that
Yeah.
happen to anybody. So I mean, hopefully, like we said, it's early too, and it's also interesting that it's so early because camp has only been going on for about a week
Right.
and a half. So
Yeah.
who knows what happened? Maybe something happened in the off season
Right.
or whatever. But
And a lot of this stuff, again, we said it already once to show. We don't have access to his medical records. We're speculating, and we're just sort of also talking about these particular issues in general, not for him, not his exact scenario.
right,
And maybe if he wasn't in training camp, they wouldn't have found it.
Right. Well, that's exactly right.
Right.
You
Yeah.
know,
like,
and maybe pot luck.
yeah. He
We'll
just
see.
he goes on, he keeps living, he keeps doing his
Yeah.
thing, and next thing
Yeah.
you know, he's got a bigger problem.
Yeah. Right.
So
Yeah.
I just did a quick Google search here just about the John Darren Boss thing. He was traded to the Saints during physical. They found a slight heart murmur and follow-up EKG revealed multiple serious heart problems. So
Huh.
I'm not going to go too far into it, but I mean,
Yeah.
just in that, like you said, just the
Similar vein.
weird,
Yeah.
like if he never got traded, would they ever found it?
Right.
Like
Right.
crazy kind of things is how it works out.
And a slightly different topic. We sit there and we talk about hockey players and how tough they are, and we
Yeah.
kind of make fun of baseball players all the time. What about last night, man?
Last night was an interesting one, right? So just another story, a little off topic, but kind of all in the same here. James
Right.
McCann, the catcher for the Orioles yesterday,
Yeah.
in the game one of a doubleheader against the Blue Jays, I believe, he took a 95-mile-an-hour pitch right off the face, right
Right.
off the basically the
Right
side
in
of his
the
nose,
face.
and he went down pretty hard. He was like kicking his legs. the
Like
whole-
he took a 95 mile
Yeah,
an hour pitch
like
in the
you should.
face. Right.
Right.
Exactly.
He gets up, his nose is crooked, it's
Right.
way off to the side. He's leaking blood.
Wonder what
everywhere.
happened there.
Yeah, curious, right? So then he goes, a couple minute delay there, and he gets. It was about 5 minutes or so. He goes to first base. He goes back into the dugout. They change his jersey because he had blood everywhere, and you're not allowed to play sports with blood on.
Right.
And then goes and catches the remaining 8 innings.
Yeah. Walks out to first base. Take your base, buddy.
tough
gets
as nails.
Gets a hit later in the
double
game.
nose plug the whole time. So
Right.
then on top of that, he can't really breathe that much.
And he's a catcher.
And he's
the
a catcher.
ball's coming at him at
Yeah.
95
But this was the
miles an
first
hour.
inning.
In the
First
first
inning.
inning.
Oh, jeez.
Yeah.
His first at bat of the day, gets rocked with a ball in the face.
Right.
And goes ahead and gets late. I'm pretty sure he got a hit later in the game.
He did.
And it's just amazing. Just
One of his eyes is like swollen closed. Like
Yeah.
I don't how you get a hit with really one eye and
yeah.
no
And
depth
how you
perception?
catching 80 to 100 mile an hour pitches for
Right.
2.5 hours afterwards.
Is he a switch hitter? Like, can he go from one side
I
to
don't
the other
think
so
so.
he
I don't
can
know.
use
I don't-
the
I
other
don't
eye?
think
You know
so.
what I mean?
But that is a good question,
Yeah.
right? Like, because
Yeah.
that's his left
That's gonna be
eye.
the dominant
where,
eye.
Where the ball's coming
Yeah.
from, like.
Yeah.
Right.
And
That's
and,
impressive.
Like, just ultimate teammate, right? Because now, granted, I think the scenario would have been different, like we kind of talked about pre-show, if it was just a 1-9 inning game, but it was a doubleheader.
Right.
So I think he was just trying to tough it out so his backup or his teammate, who
Yeah.
also was catching, didn't have to catch 17 innings that day, because
Right.
that's a whole different grueling aspect. Because catching is one of the harder. I mean, pitching and catching is probably like the hardest spots in the baseball field because there's a lot of fatigue and all that stuff.
For sure.
Catching, you're just squatting the whole time. Your
Yeah.
knees, everything else, and
Yeah.
So as a general rule, if you have a double header, do the
Yeah.
catchers always change?
not
Is there-
always. I've
is there-
seen.
Have you seen them?
in collegiate play? I've seen catchers do both games or whatever,
Yeah.
but usually followed
More
up with a
often
good
than
day
not,
off.
I would think.
But
yeah.
professionally, I would assume that more likely than not, they're not doing both full 18 innings.
That's interesting. I got to keep an eye on that. I
Right.
never
I never
appreciated
honestly
that.
checked it out that much either.
Yeah.
And really thought about it because not the doubleheaders are that they're mildly uncommon more
Yeah.
nowadays than anything because there's so much on recovery and everything else. But
Yeah.
and then he was seen afterwards. His face was the one eye was almost shut.
Right.
He looked like he was in an MMA fight. Like
That's
he looked like he was in
exactly
the
what it
UFC for the
Yeah.
you know. But I just think and then it was funny. So I was looking this stuff up on Twitter. I don't know what the pitcher was or whomever. There was a pitcher that didn't start that day for general. Come on now, this guy got hit in the face, played another 8 innings, and you're just a little tired, and you're not
Right.
playing, you're not pitching for the day or whatever the case was. And I was like, wow.
But I always joke around, and I actually don't know if this is a true story or not, but there's this old article that my daughter found at one point or another, which about a game in like, it was like 1920, baseball game and whatnot. And the difference in baseball players now versus the way it used to be, even like Nolan Ryan, right? Like unbelievable, Iron Man. And the story is, the pitcher went out and he was, it was like the 6th inning or whatnot, and he's out and he's playing, and he gets struck by lightning.
Oh,
and they revived him on the field, and he got up and finished the game.
Yeah. Yeah.
And like,
Funny.
what a far cry
Yeah.
from where baseball is right now.
Yeah.
And again, I don't know if that's actually a true story or not. Or if that's
But I've
like,
seen, I've heard about that story.
Right.
Just a little electricity,
Yeah.
What the
Yeah.
hell? Kind
Got him
of
all jazzed
jump started
Just
him. He's
raise
like, I
him
feel
up.
good
Right.
now.
Or
but
like
McCann could do it.
Yeah.
He's one of those guys.
Or I've heard plenty of times the Wally Pipp story. Have you guys know about the Wally Pipp story or who that was? He was
I recognize the name, but I
it
can't.
was
I
a
can't
first
place it.
baseman
Yeah.
back in the day I believe it was for the Yankees. And
Right.
one day he just wasn't feeling well, didn't want to start. So they said, okay, we won't start today. And then who took his place? Lou Gehrig. And he went on to play how many games he played in a row.
Right.
And so I've heard a lot of my baseball coaches like, you don't want to be Wally Pipp.
You know, that's why I know it.
Yeah.
That's exactly
Yeah.
why I know it.
Right.
Yeah,
So
yeah.
it's just like one of those things of like, sometimes taking that little time off or just toughing it out. It's
Yeah.
a little different.
It helps.
It's kind of a little bit of outcome. Yeah. Changes things up a little bit.
But also, it's at what cost, right? Like, you also don't want to throw that out there so people are so inspired that they're going to go
Right.
out and be a shell of themselves, right? Like hurt their team
Correct.
or put themselves at risk, right?
Right.
Like, which honestly, getting back to McCann, like I can't believe they let him go back out.
Yeah.
Like, I'm impressed that he did.
Right.
Yeah.
I can't believe they let him.
No, and we were talking about that. If he had some other injuries, unforeseen, like an eye injury, orbital injury,
Orbital, yeah.
and
Yeah.
it
Concussion.
undiagnosed, you just
Yeah.
don't know. Clearly, he must have been feeling well enough.
Right.
I don't know.
Yeah,
Maybe
I
the adrenaline.
Yeah, I think
You
the
know,
adrenaline factor can play a role. I mean, I've seen it before and even when it comes to, we talk about concussion and stuff, and I'm sure I've seen it where someone's get taken a blow to the head of some sort, and
Right.
they're really okay. You do a bunch of stuff, they're fine.
Yeah.
And then you see them the next day,
And it's
they're
totally
not so
different.
well.
Right.
They're not so well.
You're right.
Adrenaline goes down, the swelling goes up.
Yeah.
Right.
Everything's changed, and
Yeah.
like I've had it before. Notably, like I had a hockey goalie take a slap shot right to the face.
Right.
I went out to check him. I took my time. Everything's fine. Yeah, you passed all the tests. And you go, okay, I'm
We're
all right.
good.
We're
Yeah.
good. And then he calls me the next day, Brandon, I'm not okay. I'm like, all right, well, we know what's happening now. And, it's just one of those things where I just had a meeting today where I was talking about concussions where it's like they're not like an ankle sprain. When someone gets an ankle sprain, you see them walk with a limp. With a concussion, sometimes you can't just see it. It doesn't doesn't present itself. Not like a marquee goes across their forehead. I'm concussed. It's easy to find.
Take me out, boss.
Coach.
Exactly.
So I'm curious to see what else happens, following today. But I mean, grand scheme of things, I think he should be okay minus a little bit of broken nose. That thing was definitely broken. It was.
We'll see when he comes back, right?
Yeah,
or how long he's out,
right?
Because that will be telling if they find anything.
Yeah, and I think.
And he's the backup catcher, right? So they have what's his name?
Starts with an R.
Rushman or
right, yeah.
He's so good.
Yeah. And I mean, just to give him a little bit of time off so he can play the second game and whatnot. And I'm curious to see what reports come out after today, because I believe he was getting some CT scans and other imaging done to see.
That makes a lot of sense.
Right. But you would hope that it's not all that crazy because his eye, thankfully there's no visual problems, obviously, all that stuff. So you worry about all those things. But if all that checked out, and with that too, I'm pretty sure that the athletic trainer and that medical staff was checking in on him in between every inning.
I'm sure.
Hey, you still doing okay? You everything all right? And
they're poking around the bone.
I mean, you would see a decline at some point in time if something serious was going on. Loss of function of the eye, whatever. So. Luckily, nothing that happened, and the Orioles ended up winning, and he got a hit out of it. So,
right.
Tough as nails.
You guys been watching any of the Olympics?
A little bit here and there, trying to get into the spirit of things. Absolutely,
I love it. I love it.
It's just great that you can just wake up at any time throughout the day and turn on TV, and there's some kind of sporting event on.
Yeah.
Just anything: horse racing, swimming, ping pong, badminton, all kinds of different stuff, and it's been great.
I feel like, and I don't know if it's because. It's in Paris, so there's still that 7 hour time difference. So it's long, but it's not 12-hour time difference.
Right.
You know what I mean?
When it was like in China,
right. And I don't know if that's what it is or whatnot, but like I've been like there are some years where like I'm really like all in, and some years where I'm watching but not. For whatever reason, I've been all in this year. Totally.
Well, it's always on,
exciting.
like literally any time of day, and you can catch up.
Right.
If it's the middle of the night, then it's live, right?
Right.
Yeah, if you stay up late enough, you can get to live stuff, or early enough, you get up early enough.
That doesn't work out well with our careers.
No, absolutely not. Then you're just drained for the day. But been interesting, and before tonight, and we kind of zeroed down on our topic here. I was trying to look up a bunch of different injuries. There's been some injuries. Nothing that's like, groundbreaker, nothing haven't talked about before. I think there's been like a skateboarder, the ACL tear, and other things, and all these different things that have been going on, nothing of which we haven't covered yet. The big names, I think the big name was Simone Biles had a calf injury, and that was like, the big news.
Right.
But she still competed and did well with the U.S. team, so.
Yeah. But that was the team, right? And at this point, if we say that we record on Tuesdays, by the time it gets released, it'll be Thursday night, Friday morning. The results are out there. In fact, they're already done now. Right. So as a team, they won.
Yeah,
right?
the U.S. Olympic women's gymnastics team did win gold.
Amazing
for team. Yeah.
Yeah. So good. I mean, she's unbelievable. To watch, there's a dramatic difference between her and everybody else. It's shocking. And I hope that the calf holds up through because they still have to do the individuals, right? So man.
And we talked about calves a lot.
And what's wrong with her calf? Do we know? Did they say?
I didn't look too much into it. Hopefully,
they didn't really say.
Because on the telecast, they didn't really. Yeah, they didn't allude to anything. Just getting her calf wrapped. Okay.
Right. And then she was kind of limping around.
Yeah. And then she was fine.
I did see her a little clip, but she was getting taped up a little bit. They're giving her a little support there.
Yeah.
So maybe like a little strain, but. Gymnastics is one of those sports where they're also super tough, and they push through some stuff.
Yeah, they do.
They're probably injured a lot.
Yeah,
I'm assuming those,
they take a beating.
Probably know. Yeah,
they do.
There's always something hurting.
That, and they just have such a, they're just they move so high and they move so fast that when they hit the ground, gravity's not in their favor, and they hit pretty hard, and usually mildly catastrophic. It's like, that's not too good,
Did you? And so the men's were last night. The men's teams. That was a lot of fun, man.
Yeah.
It was pretty exciting.
Dude, I watched the men's last night, and and it was probably a rerun, but those guys were pumped. I don't know if you saw it.
Super
the
excited,
last kid that went on the
pommel
pommel
horse?
horse,
That guy.
Yeah. It
he was
great.
like
That
a
guy's
national
breaking the internet.
hero.
Yeah.
I know.
By the time he was done,
Yeah.
and probably like no one knew him.
Yeah.
Now everyone knows him.
That's all I
But they
saw
were
on the
more
internet.
excited than the gold medal winners.
Of course.
I mean, they were like
a big
they
deal.
were acting like it was the gold medal. It was,
I don't know
it
who had
was-
the line.
It was inspiring.
Roethlisberger, who was a former gymnast, was one of the guys I think that was announcing and calling. I'm not sure who had the line, but one of the lines was like that is a gold medal celebration for a
Yes.
bronze.
Yeah.
Which was a great line because
Yeah.
it really was.
Yeah.
Yeah.
It was.
And I mean, it's the thing. What I saw was like this kid was just sitting there. You could see him. He was just kind of sitting, focusing.
Right.
He only came to Paris to do the pommel horse.
One thing.
Yeah.
One thing.
Yes.
And
And
he
he did
went
it
out
well.
there and crushed it.
Crushed it. Yeah.
He didn't leave anything out.
Yeah.
He didn't leave anything else. He just gave it
Yeah.
his all.
And they medaled.
And medaled.
Yeah.
Yeah.
And that's huge. And then our the women's rugby team beat Brazil today,
That
I
one
believe.
lady, man, she is impressive.
And in walk-off fashion, it was only like
Exciting.
10 seconds left, and
Right.
they ran all
Oh,
the way
really?
down the field. And she ran over, I don't know, 2 or 3 women on the way down there, and she got the I forget what it's called, a try or a touchdown in rugby.
Yeah,
And
I think it's a try.
it's
right?
a try, right? Yeah. Impressive, and it's so exciting to see because you see all these different, and then it's fun just to kind of get into it and kind of learn about the Olympians a little bit, all their stories, all of what they did to do. Like we mentioned, the 58-year-old who's out there doing it. And
Yeah.
all these different people who have these crazy stories, the comeback stories.
There
all
was
this stuff.
a female gymnast, I think it was Indonesia. I forget where she was from. Or maybe like Laos. I forget where she's from. Much like a smaller country that does not typically have a lot of Olympic athletes.
Right.
And she tore her ACL, I guess, like a week before the Olympics. And they had let her go out, and she jumped on the high bar or the uneven bars, did a few different spins, kind of popped back and forth between them, and then just came to like basically a slow stop and just jumped down. Just so like
just
she can
to say she competed.
I competed in
Yeah,
the Olympics. Yeah. And it's it's
And
interesting.
it's exciting because I've seen people who've gotten engaged already after their events. They proposed to significant others.
Oh,
or-
right. Was it Ryan Murphy where
Yes.
his wife held
held up
up?
the thing
It's
about
a girl.
It's a girl. Yeah, about finding out what he's about to have. It's like
Right.
just all those cool things. I
Yeah.
mean, you can't beat the whole
exciting stuff.
aura of the Olympics. It's
Yeah.
just too much fun.
I love it. I do. I love it. And then hopefully next week we have a little Olympic-based show. But
Yeah.
we'll see where it goes.
We'll see where that
And
goes.
in 2028, they're in LA.
I
Yeah.
know. I
So
know.
that'll be
I love it.
exciting. Yeah.
It's
Yeah.
exciting stuff.
Yeah.
fun.
I'm trying to
That's
figure
awesome.
out like the different teams. We have one of our docs, Dr. O'Donnell, Kevin O'Donnell. He's one of our sports medicine docs. He works for USA Sailing, and he's out there right now.
Yeah.
He's in Paris for the Olympics. So a lot of the teams, the national teams, they have the docs that they use. But I know some of the athletic trainers that I work with are trying to like there's a protocol to go through in order to like be there to be able to be eligible and do
Yeah.
it. And similarly, like I want to figure it out. Like it's a once in a lifetime kind of a thing. To
Yeah.
be able to be there and participate.
Yeah,
and
it's
watch
on my
and-
bucket
yeah,
list.
yeah,
It's
exactly.
a thing. I know for an athletic trainer, I've looked briefly into it, and I've met someone. I forget where he was from, but he gave a presentation once about. He went to Beijing, I think, back,
Right.
and it's like you have to be 3 years certified. I'm well over that, so I'm
Yeah.
ready to go.
Just made it.
Just made it. You got to apply, and then you kind of like volunteer your way in. You kind of go to like
You volunteer your way
the
in.
Olympic training centers for
Yeah.
a little bit. You do a little bit of stuff like that.
Yeah.
One of my former program directors was working with the ice skating team, I think, for the Winter Olympics.
Yeah.
And she went to somewhere for that as well. So it's just like people do it. You just
Yeah.
got to have the right time, and you have to have the right support network. 'Cause
Sure.
you're gonna have to take some time off of work to figure it out to
That's
kind of
a
go
big
back
part
and
of
forth.
it, right?
Right. But I met a lot of people, and it's got to be one thing to hear the national anthem on the Olympic stage.
Right.
Like
Right.
it's-
Right.
Right.
You can't beat it.
Amazing stuff.
Yeah.
Yeah.
Well, I think that wraps up what we got. And Dr. Poots, thanks for coming on, man.
Well, hey, thanks for having me. And the next time you have an esophageal tear,
Yeah. You're the guy.
You're the guy.
I'm the
Go,
guy.
So we got it. So we're just going to give a quick shout out to our sponsors here, Virtual Orthopedics and Spine. They have you covered from runner's knee and dog walker's hip. They have a doc for that. Yard work back or laptop wrist. They also have a doc for that too. Virtual Orthopedics and Spine has over 120 providers, over 20 PT and rehab facilities, and more than 25 surgical centers across South Jersey. So find the right specialist for you at virtual.org/ortho. Neck of the Woods Brewing Company, serving some of the best beers in the South Jersey
Oh, so
area.
good.
Oh, so good. That strawberry basil tonight was on point. And lastly, Timberreal Productions and our guy Kyle helping us get all this stuff together, because Dr. Frey and I wouldn't know what to do without you.
Oh, so good. Again.
So thank you, everyone. Have a good one, and we'll see you next time.